Good evening, everyone. On behalf of UNICEF, I'd like to welcome you to our COVID-19 Youth Technology Challenge Demo Day. We'll be showcasing the top 10 projects that our teams have been working tirelessly on over the past few days. At the end, I'll be announcing the names of the top 3 winners who will have the opportunity to participate in a UNICEF Generation Unlimited incubation program and will receive $1,000 to continue their projects. I hope you're as excited about seeing the work as I am. Thank you.
I'm Saada Salti. I'm the founder of Teryaq. The market research showed that 82% of people are unable to reach the pharmacies in some circumstances, which might result in future medical complexity, threatening society's health, and increasing government burden. Unfortunately, this percentage might currently increase due to COVID-19. And for those people who are able to reach the pharmacy, they are in danger of the virus, as pharmacies can be considered as one of the places that could have high potential of spreading the virus. The application came as a solution by acting as an intermediary between the pharmacies and the customers. By displaying most of the pharmaceutical products in the app, allow people to order and deliver their required products to their doorstep after the pharmacist approval. It also provides free medical consultation with high reliable authorized pharmacists. Within the next 17 months, we will be able to capture at least 5% of Muscat market share, which will be resulted in revenue of 7.2 million Oman Riyal per year. We have 2 revenue models. The transactional revenue model, we will get 5% commission on medical products and 10% commission on non-medical products, in addition to the delivery fees taken from the customers. The subscription revenue model will be done through the displayed nearby pharmacies. The application will be designed to be user-friendly, easy to navigate, and easy to track orders. The delivery process will take no longer than 90 minutes, and the customers will be able to reach and chat with high reliable authorized pharmacists. In addition, they will be able to locate nearby pharmacies. Currently, we're working on getting approvals for delivering the prescriptions. The only direct competitor in the market is Pharmacy Express, and their delivery time is somehow long. The other competitors are classified as indirect competitors with very few range of pharmaceutical products to compete against us. The team, besides me, Farida Saidi, she is the co-founder, she is finance and marketing specialist. Basma Shaydani, she is the COO, she is management and finance specialist. Nasser Ali Arbi, he is the CTO, he is information system specialist and app developer. And Ahmed Al Busaidi, he is the CIO, he is information system specialist and graphical design expert. Just recently, we've negotiated with 2 pharmacies and got secured their registration in the app. And currently, we're working on getting approval from at least 23 more pharmacies before the application launch date. Also, we are working on getting approvals for delivering the prescriptions. Finally, with your support, we can reach a society with maximum healthcare services and products. Thank you.
Hello, my name is Halim, and in this video I will talk about Rukn, our idea to help people to run their businesses from home. Due to the current pandemic situation, so many people were forced to stay at home, and as financial situations were widely affected, many thought about starting a source of income while at home. Me, for instance, I'm a self-taught artist, and my friends advised me to start selling my paintings online. However, I couldn't find that perfect platform that is made for this type of activity. The existing platforms, I couldn't track my orders, couldn't reach my target audience, neither handle my transactions and deliveries very well. Hence, introducing to you Rukn, the very first online marketplace for you to showcase your handmade goods or products and put them directly in the hands of your target audience. If you stitch abayas at home, or create customized phone covers, or even digitally print on t-shirts and mugs, then Rukn is just for you. Rukn allows you to create your customized store where you can add or remove or edit products. It also connects you to your target audience based on their interest. It helps you track your orders to know your total sales and profit through a simple business tool. And it also provides delivery services. To have an idea of our targeted market size, last year we have organized an exhibition in our college where a total of 100 stalls participated for a duration of 3 days. The exhibition recorded more than 60,000 Oman riyals, a total of sales. That means around 200 Oman riyals in 1 day for one stall. On the other hand, a survey was conducted on 19 people, asking them why their online businesses stopped, or why did they stop their online businesses. Around 65% of them answered or stopped due to them getting very few orders. However, the remaining 35 couldn't really manage their deliveries. Now, unlike OLX and other platforms, Rukn will be a great solution for those people. Here are some screenshots of our app, which should be easy to use and user-friendly. And this is my valued team. We have all the ingredients to make Rukn stand out from its competitors. Thank you, and have a nice one.
Hi, my name is Zia, and I'm the CEO of Ingine. We are a software app that helps teachers and students completely change how we learn online. 3 years ago, I was studying chemical engineering, specialty in nanotechnology. And we have so many textbooks that are so big, but also boring. And I could not understand what was expected from me to learn. So the solution my team and I came up with is empowering the teachers to take an old-fashioned textbook and all the images that go inside of this textbook and link it with an audio or a video. For example, the student would be able to look at this textbook, look at this particular graph, and scan it. A little notification would show up, a little pop-up that will lead to the audio or the video provided by the teacher. Now this is crucial for the student to understand what this graph really means and not be bored. As a student, yes, I could go to Khan Academy. Yes, I could go and find the formulas online. But when the exam would come, it did not help me, and therefore I had to go back for the damn boring textbook. Hence, this solution would serve someone like me, but also all the students around the globe that could benefit from this. My team and I launched the software back on October 2019. And by March 2020, we had over 1,500 downloads. And within the 2 days of the hackathon, we started transitioning from a native application to a cloud-based solution to improve the performance and the efficiency of the app. And in the future, we are trying to get up to 50,000 downloads by the next year. To do so, we need an investment that would bring an additional developer on board to help us scale this within the MENA region. Furthermore, get a letter of intent from universities that would be willing to pay for such a service. The team involves me as a CEO and my co-founder and CTO McNell Sylvester and our senior software developer James Timberlake. Support us to get a step closer to defeating the coronavirus outbreak that completely disrupted the way we live. Ingine is a software that could change completely how we learn online. Thank you.
Thomas. Today I'm going to introduce you to our online mobile healthcare application called Wasla. Wasla in English means link. We were inspired by a very important component in the body called neuron that provide the body with the signals. So Wasla will be the platform that links between the healthcare providers and patients. What we're going to link on Wasla, we will link hospitals with medical centers, we will link government with the private sectors, we will link pharmacies with insurance companies. In our daily life, we face for sure one of these scenarios. Imagine yourself, you got sick and you spend a lot of time searching for the best specialist. Once you go to your appointment, you might stuck in a traffic, so you will skip the appointment or you might forget about it. When you go to your doctor, you might miss any important information about your medical history. And one more struggle, when you get your prescription from the doctor, you go to the pharmacy, you might get it lost, or you might not find all the medications mentioned in the prescription. So in this case, you will have to go to the doctor again and provide you with a new prescription and go to the pharmacy one more time. Imagine yourself traveling abroad and having any emergency case, so you will not be able to get to an access to your medical records. So in Wasla application, in our phase one, we will solve all these problems, and we will try to support our health life to get it on the right track and for sure on a faster track. So what are our services? For sure, we will start with a directory for healthcare providers. The patient will be able to have online appointment scheduling. He will have an online prescriptions. He will have an online medical reports and lab tests. And he will get reminders for his medication and appointments. The doctor will get reminders to follow up on his patients regularly. We will, on top of that, have a 24/7 service for doctors in cases of emergency for the patients. All this data will be registered on our ID cards. Of course, after the approval of the Ministry of Health and ROP. If not, we can get it on only the application or any smart card. So what the patient wants, the patient's priority is online scheduling that ensures for him flexibility with access to his medical record that can share it with the doctor that he wants. And on top of that, confidentiality, security for his information, a 24/7 service. And one more thing to get, we will be able to mention all the doctors or healthcare providers' profiles, so the patient will have access to it and choose the doctor that he prefers. What the doctors want to reduce the no-show or the cancellation rate of the patients that happens every day in their life. And they want a full access to the patient's health records and reports. What the pharmacy wants? The pharmacy, they deal every day with a lot of papers regarding prescriptions and getting approvals from health insurance companies. And this will be like, it takes a lot of time. So from our application platform, it will be paperless and contactless, and it will consume the time. So everything will be digitalized from the prescription till it reached the approval of the health insurance company. We will ensure to the health insurance companies as well to reduce their frauds and to ensure to reduce the time of the process of the approvals. And for sure, it will be contactless, paperless as well. What about the government? We will have a link between the government, so the Ministry of Health can have a full access on the data of the private sector. We will have this in our phase 2 of our application. So we will have a reliable data that can be used by new investors coming to the market, or many organizations like WHO, like many UN entities, or another investors coming to the market. So it will have link between government and the private sector. These statistics as well, it can be used in many studies, as we can see from the pandemic that happened, COVID-19. So we will have like a reliable statistics that can be made a lot of studies on it. Let's talk about our financial studies. We started with 74 hospitals. Out of them, 10 hospitals are private, with 1,000 private clinics and more than 200 government health clinics, more than 8,000 doctors they are existed in Oman till 2018. On top of that, the population of Oman exceeding 4.5 millions. Out of them, there are 2.1 millions of expats. When expats, they renew their visa, they will need the blood test, and it's a very long process. So by this application, it will be paperless and it will be time consuming. So they can get everything by this application. And we will start with, in this scenario, we will start with 600 doctors, 50 pharmacies, 8 insurance companies, and 2 advertisements. And the fees are mentioned in the table. This fees will charge not to the patient for sure, it will be charged to the hospitals, it will charge to the healthcare providers, and in the second stage, it can be charged to the investors or to the organizations that they want to use our data, the statistics. So in a very conservative way, we did our cash flow. So we are expecting to get a positive revenue starting from 500,000 in 2020. It will reach in 5 years. It will exceed the 4 million. The marketing strategy, of course, in Oman, we have like a few competitors, but I don't consider them as main competitors because all of them are only like directory and online scheduling service. Our target is the adults in this application for sure as patients. There are more than 3.7 million adults, and out of them, there are more than 1.4 that are in the median age of 25. We will publish this in social media for sure. We will have brochures during events, medical events happening in Oman, and by hospitals as well, and pharmaceutical conferences. On top of that, in our phase 3, we will have a service for awareness that will be sent by messages to the patients, and we will have the medical trips service. Now, before I finish this, I want just to introduce you to our very tiny team, which is me, Emma Thomas. I'm a pharmacist, and my colleague is Maroon Ajram, a business development manager. And for sure, we're looking forward to the future to grow our team. And thank you so much for the support by this challenge platform.
Hi everybody, this is Khadija, team leader of Qudra report. My friend went to hypermarket and she was wearing mask and gloves correctly. However, after a few days, her mother was admitted. Now, we can realize that the risk of catching coronavirus could be by touching various surfaces in hypermarket. And according to the CDC and the WHO, the coronavirus can be survived in services from hours to days. That's why we came up with Qudra Smart Sterilization Report. It sterilizes outer clothing of employees and clients and various surfaces. 93% of our targeted group believe that sterilization report is essential at this time. Our market size show that the total available market in MENA region and Africa is $0.5 billion per year, while the sum in Oman is above $15 million per year. We are going to start with hypermarkets and end to the government sectors. Qudra reports revenue is going to be by selling and renting reports, as well as after-sale services, which include selling sterilization liquids and report maintenance. Unfair advantages: we have great international relationship and cooperation with experts. Qudra report is mobile, affordable price with high quality, and it can be used after COVID-19 to eliminate hospital-acquired infection and reduce student and employees' absence due to the seasonal influenza. And our next step is to obtain further investment and expert consultation in various fields. our great team, Mr. Bashar Al-Awaidi, mechanical and robotic engineer, Huriya Al-Mahlouqa, administration and marketing, myself, pharmacist. My field is policy and prevention of HIVs. Although Qudra report is 6 weeks old, however, we have been chosen in GCC hackathon by the People Choice Award winner. For further information, you are most welcome to contact us. Thank you. With Qudra report, life is by nature and no lockdown.
Hi, my name is Rami Sharawi, co-founder and CEO in CADhub, the integrated technical networking platform. As professionals in the field for more than 12 years, we found that there is a common problem among engineers, designers, programmers, and other similar disciplines. Each of these individuals seek a number of services that could hardly be found in one single platform. Users would need a platform to network and connect with peers of the same profession, share their work, and explore the state of the art of their profession. They would also need continuous support through question and answer services, learning new skills in software, and finally, get connected and exposed to the work environment. In fact, it could be argued that all of these needs are already fulfilled through existing platforms like Facebook, Stack Overflow, Udemy, and LinkedIn. But the question is, do these distinct websites really fulfill the needs of the users in an efficient way? No doubt these websites are pioneer in their fields. However, none of them was designed to fulfill users' needs in a single comprehensive platform. By the end of the day, programmers, designers, and other software users find themselves scattered and distracted between a number of plethora of resources. This leads to waste of time and resources. As a matter of fact, there is no single efficient technical sharing social platform. CADhub steps in here to offer the solution as the world's first technical networking social platform. CADhub will allow for the all mentioned service to be fulfilled, all in a single platform that will be recalled in just one click. Based on extensive research, we have found that the market size is immense. For example, in the top 5 course provider websites, Arab users exceed 4 million users. Based on these mentioned numbers, for phase 1 of the project, we decided to target the Arab-speaking users in the MENA region. The platform is designed to cover a variety of services through seamless and easy-to-navigate pages, which guarantee effective and yet simple experience. Regarding the business model, beside the free subscriptions, the platform will depend on annual and monthly paid memberships, in addition to the paid ads. We are discussing here a clear unfair advantage. We believe that traffic is guaranteed. This is not just a dream. We have already launched a beta for the platform back in August 2019. In terms of visit counts, the website now has 451,000 ranking globally, with most of the visitors already from the MENA region. The platform is live. As we're talking now, the website attracted 33,000 users. According to our current statistics, the platform is expected to attract 5% of the Arabic-speaking users that use Q&A and course websites. This would make an annual profit of $42.2 million, as the project directly serves and covers 5 of the 6 categories offered by the challenge. The team is comprised of different technical and academic expertise. Mohammed Qarqash is the founder, CEO, and business model developer. Myself, Rami Sharawi, the co-founder and COO and quality manager, currently finishing my PhD in building simulation software. We believe we are presenting a special not-to-be-missed opportunity. And together, with your support, we could fulfill our dream of providing the #1 platform within the coming 5 years. Thank you very much for listening.
Hello, my name is Wasla, and I'm a current student at UCL pursuing a master's in the field of precision medicine. And I'll be introducing you to our revolutionary online health services platform, Faz'a. Approximately 75% of Oman's population seek family medicine advice per year. With no current telemedicine platforms or apps available, gaining remote access to family medicine practitioners continues to be a challenge. Therefore, we've created Faz'a, an app that seeks to connect patients to family medicine practitioners virtually, easing them into the field of telemedicine. Our global market size of telemedicine is $35.5 billion. Our serviceable addressable market is $395 billion. and our serviceable obtainable market is almost $5 million. We hope to penetrate the 15% of Oman's market, equal to $735,000. We hope to establish multiple streams of revenue with our business model. Our primary stream of revenue will be the monthly subscription. Additionally, we'll also have the pay-as-you-go structure, where the patient pays according to the services rendered to them. Along with being more affordable, we aim to further differentiate ourselves from the competition through our proprietary AI-based system that helps patients to self-diagnose from the comfort of their own home. It gives me immense pride to say that we've won the Open Hacks 2020 hackathon whilst competing against 800 teams globally. Additionally, during this hackathon, we built the prototype and our official website from scratch. According to our plans, we aim to complete our mobile application by mid-July, with a market release of a pilot run planned for August 2020. We hope to expand further throughout the GCC and eventually MENA by 2027. The team consists of myself as a CEO with a passion for optimizing healthcare. Our COO is Said Mahi, who specializes in organizational management and digital marketing and is a mechanical engineering graduate. Our CTO, Tazeez, has over 7 years of programming experience and has won 7 out of 9 hackathons this year alone. Our lead developer, Rifat Hilal, holds a degree in software engineering. Together with Faza, we hope to revolutionize the healthcare industry in Oman, and we are seeking advice and guidance from you today. Thank you for listening, and we'll end with a short demo of our prototype today.
Hello, my name is Maria, one of the 7 members in the Tazeez team, a platform that serves kids with special education needs in the MENA region. I would like to start with a story that is close to my heart. Amira, one of my relatives. She's a mother of 4 children and lives in the Sharqiya region. One of her children, Ahmed, suffers from mild autism disorder. He needs speech and special education sessions. Unfortunately, the poorly qualified teacher in her area means she has to travel with Ahmed all the way to Muscat to get a proper consultation and classes. This is not just time-consuming, but also causes destruction and separation of her family members. The problem got even worse during COVID-19, as Ahmed's education stopped, and she had to put massive efforts in homeschooling him without any supervision from a specialized teacher. You can imagine the number of families who face the same difficulties every single day. Based on the survey we conducted, 70% of specialized teachers and 55% of parents with kids of special needs think that stopping the child's education for a long time can have a big impact on their performance. Because this is a widespread problem, we came up with what we think a very unique solution to cover a wide region, and that is a specialized online learning platform for kids with special needs. Tazeez, that is what we call it, because we believe in empowering every child with the education they deserve. All you have to do is to register your child so that his condition can be evaluated. A special education teacher will be assigned. Everyone then can track the progress of the child through the platform. In addition, parents will have access to our online tools and exercises that fit the kids' needs. Our beachhead segment would be slight autism, learning difficulties, speech and language therapy, because all of those segments have the capabilities of learning online. Our revenue model will consist of simple but flexible monthly subscription packages. A typical student will need 8 sessions per month that correspond with a revenue of around $120 per month. We plan to move from local market to the wider MENA region with a potential of achieving $20 billion. Unlike many of our existing competitors, our value will rely on our ability to provide online access to specialists from various regions. And secondly, we have customized and flexible material depending on the child's ability and his progress. So far, we managed to reach around 200 parents and teachers in one day from 9 different countries in the MENA region. 60% of those pointed out that having an e-learning platform would greatly support their kids' education, whilst 30% think that it will complement their studies in existing educational centers. Now, this is not where we want to stop. We are planning to expand to other cases that have the ability of learning online, such as moderate autism, mild mental retardation, and hearing impairment. We already launched our landing page to measure the traction of those types. Together, our team have 40 years of experience with different backgrounds. For example, Mr. Mohammed is a specialist in the field and the founder of a special education center in Egypt. With your help and our determination, we can provide the needed education to any child that he deserves at any time and wherever he is. Please contact us to get our insights. Thank you.
And I'm a part of the Somalian tech team. Today we will talk about the story of Ahmed and Maryam. Due to the recent situations in Iraq, Ahmed couldn't go to his primary school and had to stay home because of the demonstration that took place in Iraq recently, followed by the COVID-19 pandemic. While Maryam is deaf and mute and had nowhere to get her education from, e-learning from the government couldn't do justice to Ahmed. Both Ahmed and Maryam had to stay home for almost a whole year without getting useful and accurate education for children compared to children around the world. According to the Ministry of Planning in Iraq 2018-2019 calculation, about 7 million students in primary school are suffering from the situation. To help those children, we, the Somalian team, will create and design an interactive application that is visually appealing to primary school children. Nabu is an application named after the god of literacy in Iraq ancient civilization. This application will be a powerful tool by giving information in various fields and knowledge. Through specialized teachers and training, they will use an interactive and creative and visually methods and not the plain academic methods that children suffer from in schools. Therefore, we don't depend on the curriculum, but also on teaching all types of fields in an age-appropriate way. Regarding deaf and mute children, all presented content will be available in sign language and interactive way to facilitate teaching and learning from home to this deprived group. Since there is no focus on teaching sign language to parents and children, we will have a section specified for them. We don't simply forget the negative effect of electronic devices usage, excessive usage in children. We have a specific amount of time for their children usage. This application also follows the United Nations Convention on the Right of the Child, CRC. According to the survey of our community, the demand for such an idea is very high. Our application is aimed to, firstly, in Iraq, with a value market of 168 million a year. Then we plan to launch in the GCC, followed by the MENA region. Our application has a subscription service that charges $10 per month, with an additional $5 per day for a private education session feature. This application idea is unheard of in Iraq, which will distinguish us by creating a solution to this enormous problem through keeping up with the technology. There is a competition between our application and others like YouTube and Classroom, but what will distinguish us is our private education, followed by our specified teachers and trainers, and our selection of a group, specified selection of a group, which is primary school children and deaf and mute children. Our team consists of 3 IT graduated, followed by a freshman in engineering and a second year at law school. Thank you, and our contact information. With your help, we will help thousands, millions of kids around the world. Thank you.
My name is Shakir Narwat. I'm the co-founder and CEO of SkillTell, and these are my lovely teammates. SkillTell is an educational and online video platform that encourages creators and innovators from any and every field, and especially people with special needs and women, to pass on their knowledge to others and earn money from it. It also enables viewers to learn thousands of cutting-edge skills from one place for free without the need of a paid subscription, because of our belief that knowledge is a power that everyone should have access to anytime and anywhere. What does so many youth in our world and around the world have in common. They are unemployed, they have untapped skills, have the passion to teach others, and in a strong need of media money. That's why today youth unemployment in Palestine is an all-time high at 49.6% and an all-time high at a 27% in the Arab world. Our research and analysis shows that the causes and reasons for high unemployment are economic and political instability, lack of proper training and readiness to enter the job market, lack of access to job resources, and lack of international and online jobs. And that last one is what takes us to SkillTell. SkillTell is an online video platform for people to upload videos to teach others the skill that they have and earn money generated from ads based on the views each creator's videos generate. In a time when college graduates lack the skills needed to perform at the highest level in the job market, causing a rise in youth unemployment, our platform will provide graduates with the opportunity to learn new skills for free, which will increase their chance to compete for jobs in their fields or even tackle and enter into new jobs or fields they were unfamiliar with before. Because we understand that our creators come from all backgrounds and fields like music, tech, or even cooking, most of them wouldn't be comfortable editing and montaging their videos in editing software. Our platform will be the first video platform to offer a built-in simple video editing software. Our platform will provide thousands of jobs directly, thousands of jobs indirectly. Our viewers and creators will learn new cutting-edge technologies and skills. People with disabilities and women will be encouraged to start jobs from home on our platform, and all of that for free. Our main competitor is YouTube. As the #1 online video platform in the world, YouTube fails to be an encouraging platform to training videos for the following reasons. One, training videos on YouTube have to compete with other diverse videos which have a huge production power, giving training videos a huge disadvantage. For example, here we have a very good guitar lesson filmed at home, and it has to compete with the Lion King movie from Disney, which has a production of $50 million. Two, YouTube takes 70% of revenue generated from ads and gives 30% to the creators, making YouTube almost an impossible place to start a career in. Our platform will do the opposite. We will give 70% of the revenue to the creators, and we will take 30%. The average SkillTell creator will make $500 a month, while the average YouTube creator makes right now $150 a month. Also, they will be competing with us for viewers, not only the creators, because they do not offer an option for creators to post content. More than anyone else, people with disabilities are being neglected by the job market. Today, 93% of people with disabilities and 66% of youth women in Palestine are unemployed. While our creators will take 70% of the ad revenue, our creators who have disabilities or women will take 90% of the ad revenue. Are we reinventing the wheel? As my favorite actor Leonardo DiCaprio says, absolutely not. What we are doing is giving the world what it has long waited for, an online video platform where creators can upload training content and make money off of it. Simple to use with built-in editing software with financial incentives higher than any other video platform. We are SkillTell. Thank you.
And the winners are, in no particular order, Fazza, SkillTell, Tazeez, Teryaq, Ingine, Nabu. Congratulations to all our winners.